So the acronym, Health Insurance Portability and Accountability Act. This law is very robust. It's like an octopus. It gets into a lot of different areas of regulation and law within this country. But all we're dealing with, when we talk about HIPAA compliance, what we're talking about is privacy and security. Those small aspects of this law, I say small, but that is our biggest risk. That's what we deal with as compliance officers. That's what we deal with as business owners of a business associate anyway. The problem inherently with HIPAA, as you'll see when we go through sort of a mock risk assessment relating to texting and emailing and transmitting PHI, is there's not a perfect answer for all of this. It's a very principles-based regulation. A does not equal B. A equals what risk dictates it equals. And when we start talking about, for example, emailing, what can and can't we email? Encryption, for example, is not required. It's addressable. But if we're not doing it, we need to explain why we aren't and how nominal are the identifiers that we're actually sending that are considered protected health information. That's how we make these judgment calls. And we'll look at that again later on. And it's not one size fits all, certainly. What's necessary for Bethesda Medical Center, where you've got thousands of staff members, you've got health information all over the place in paper form, electronic form, being transmitted here, there, and everywhere, there's a lot of risk there. So that's very, very robust versus some small doctor's office in South Georgia with, say, 4 staff members. You know, much, much lower risk, not nearly the amount of working parts. But, and this is very important, it does not matter your size and scope. You have to be proactive with your compliance. Do not be in a reactive state. And when you start looking at these standards that we need to abide by, quite frankly, it's a bunch of common sense in the end. That's what HIPAA compliance is. It's best administrative practices, best physical security practices, and best technological practices. And boil it down, a lot of common sense. A lot of where people fall short with their compliance is lack of documentation, lack of writing down and bragging on what you're actually doing. Because typically, folks are pretty close to where they need to be, in my experience, but you lack policies. You lack the fact that you've actually gone through the process and staying on top of the process that is required by law for us to do. So a little bit like the boy who cried wolf, you know, because we've had these laws for a long time. They weren't really being implemented. Yes, you may get an audit if there was a massive breach or a complaint, but certainly nothing really going on proactively. So folks became desensitized to it, just like the villagers became desensitized to the boy screaming wolf. People sweep it under the rug. We got other things to deal with. We're very busy as practice managers and compliance officers. HIPAA's important, but, you know, there's bigger fish to fry. So, unfortunately, the wolf has arrived. And I jest with these pictures, but I've been doing this for years. And back in, say, 2003, early 2000s, my consulting firm probably dealt maybe 15% of my time dealt with HIPAA, with securing protected health information in compliance with HIPAA. Now it's about 115% of the time. There's not a week that goes by I don't get a call from an attorney wanting to know, did this thing that happened, does it constitute a violation of the federal HIPAA laws? Did it not meet reasonable and appropriate due diligence under the HIPAA laws, in your opinion? I get calls from practices, from hospitals, from groups all over the country, business associates, stating, oh no, we are being audited by the federal government for HIPAA. What do we do? What do we do? I get calls from business associates in particular saying, oh no, we're losing this client, or we can't get this new client because they're asking us all this information about our compliance. Because these days, covered entities, a lot of them are doing that because they're required to by their cyber liability insurance. So nothing that we can ignore anymore. And again, not trying to scare folks, because this stuff is not rocket science. It's just not. When did everything change? When did it get serious? It got serious when the HIPAA final omnibus rule went into effect which was towards the end of 2013. So prior to that date, HIPAA was like this poodle. Yes, it could bite. Yes, it could be annoying, and it did bite a few people. It didn't hurt real bad, but it bit a few people. It could pee on the floor, but it wasn't an imminent threat. It wasn't a proactive threat like a honey badger. These days, we can be audited for no reason. Bad luck. Just like these little critters, they will attack us for no reason, unlike the poodle. So let's talk about the final omnibus rule real quick, and I promise we're going to segue into the meat of this, which is emailing, texting, personal devices, and all that fun stuff shortly. So with omnibus, the penalties are increased. The burden is now equal between business associates and covered entities. So what do I mean by that? If you are a business associate and you notice your client, the covered entity, is doing something in a non-compliant manner in the way in which you do business together, and you continue to do business with them, you are also guilty in the non-compliance and can and probably would be held accountable. And I've seen this play out a bunch. So businesses must monitor the covered entity as well. It's a bidirectional responsibility. It enforces what was already on the books, basically for covered entities, greatly enforces and increases proactive federal audits. And 2017, well, technically, 2014, 15, 16, 17, all of those have been record years. And now we know 2018, there was more audits, more fines than 2017. So it's been, the trajectory has been skyrocketing upward, and the assumption is probably 2019 will be more fines doled out than 2018. Two reasons. Number one, primarily, the government is enforcing the law. Number two, the individual remedy. Why do I keep talking about that? Because the federal government, when they told the state's attorneys general to implement laws of remedy in your state for wrongful disclosures of folks' health information, but if you're going to sue, file your complaint with us first. So the federal government is getting more complaints filed than ever before, in part because of the remedy, the individual remedy. So they're getting more investigations. More investigations occur, more fines happen. Even if the complaint turns out to be null and void, we still get investigated, and if we do not have an adequate compliance program, we can be fined nonetheless for willful neglect. So historically been pretty benign, no consequences for actions in most cases, more of a nuisance than a real problem. Fines were low and rare, audits were very rare, and only the federal government could assess a fine on behalf of a patient. That certainly hasn't changed. Federal government always assesses their fine, but patient can now get remedy under their state. Audits have begun in earnest. Big, small, short, and tall, it does not matter your size and scope. Statistically, it is smaller medical practices and business associates that fare the worst in audit. Clearinghouses and insurance companies certainly are at risk because they're covered entities, and the federal government is not accepting the same old excuses as in the past. Personal responsibility. Make sure that you train your staff, that they understand that we all have personal liability under this law. If I do something stupid with someone's health record, if I make a disclosure or try to maliciously slander someone with access I had to their health record, that is a criminal offense. That is a violation of their federal civil rights. Our job as compliance officers is to train folks, our staff, to clearly know that because if something like that did happen, we are going to get sued, the practice or the hospital. Now, the individual might as well, but we have to prove we did train this person. We background checked them when we hired her or him. We made sure they signed confidentiality agreement. Every other staff member knows this. They're trained formally upon hire, formally annually. We have policies in place. That's how this works. It's a personal responsibility law, provided we have done our responsibility as the covered entity or the business associate in adequately training those folks on that. Now, HIPAA is not just about access. HIPAA is not just about security, but it's also about access. Patients have a civil right of access to their health information. And there's been a pretty significant change relating to emailing and transmissions of a person's health information. They have a right of access. They own the record. If the patient wants their health information emailed to them and you cannot encrypt, it doesn't matter. It's their email or their information. We need to send that even if it's not encrypted. We'll get into more of that later as we move along. Now, business associates, and I don't know who all on this call are business associates or who all are covered entities, but there's about 7 times more business associates in this country than covered entities. Those are the third parties that create, receive, maintain, or store protected health information on behalf of a covered entity. Answering services, medical transcription, IT groups, medical billing, shredding services, attorneys' offices sometimes could be, collection agencies perhaps. Those would be considered business associates. Now, these days, businesses have to comply directly with the law. And by the way, the federal government is making a concerted effort to go after business associates more than ever before. And they're very transparent about it. They state that if our intended goal as a nation is to better secure American health information, then we need to know where it is. So what they've been doing is sending out thousands of letters as well as emails, primarily to covered entities, but to some business associates that they know about, wanting a complete list of all of your business associates, 2 points of contact, what they do for you, where's their website, or what's their website, their physical address, all this information, because the government doesn't know who the business associates are. It's hard to know that because they're not typically dealing directly with the government like a covered entity would. And they're doing that to start auditing them to ensure they are being compliant. Now, as I mentioned before, when businesses come to me, typically it's not so much that the federal government's hounding them every once in a while, but it's primarily because, well, first, they want to be proactive and do the right thing because they have to by law. But secondly, their clients. They're losing clients. They can't get new clients because the covered entities these days want to see more proof that the business is compliant above and beyond just signing that business associate agreement. Like I said before, it's for their own liability, and their cyber liability policies many times require that. So definitely something to consider as a business associate. Now, our new, well, I wouldn't say two, I get a lot of questions, I'm not going to spend but a minute on this, about political changes. Well, HIPAA is a regulation. So if you have an anti-regulatory government at the time or a pro-regulatory government at the time, well, HIPAA being a regulation, we're dealing with primarily an anti-regulatory government, so, they're not going to enforce it. I don't know about other regulations. I have no clue, but let's look at the facts. It doesn't really have anything to do with this. Roger Severino is the only political appointee that has anything to do with this as the head of the OCR. The HIPAA laws are a congressional mandate that are enforced by career staff members, not so much politicians. And there has been a big push from the last several years to do more, but it's been a bipartisan push. So Mr. Severino, real quick, very capable fellow, JD from Harvard Law, received a master's degree in public policy with highest distinction from Carnegie Mellon, has a bachelor's in business from Southern Cal, where he was a National Merit Scholar. He was a trial attorney, did a whole bunch of things at the OCR. I'm not going to get into too much of that, but despite what we would think is an anti-regulatory director, let's just look at the 4 largest fines from the last quarter of 2018. So he also stated that if you're taking federal money, basically if you're in the Meaningful Use Program, the MIPS program, you're taking Medicare, Medicaid, you have a higher risk of audit. And that's a straight quote. So that would lead you to assume if you take federal money, you have a higher risk of HIPAA audit. So let's look at these fines real quick. And this will parlay into texting, email, but primarily in personal devices. But so to put this in perspective, this is the 4 largest fines from the 4th quarter of 2018. The entire year of 2017, I think we had about $2 million total in fines. I'm sorry, in 2012. In 2012, before the final omnibus rule came out, we had about $2 million in total fines. And these are individual fines. And the common denominator here with every one of these groups is neglect and cavalier approach to the law. The government will not fine you if you can prove you haven't been neglectful, you put policies in place, and you've worked to lower your risks of breach. Breach is going to occur. Our job is to lower the risk. Now, Presence Health got a $475,000 fine because 836 paper-based operating room schedules went missing. Patients have a civil right to know if their information's gone missing. It's called breach notification. They knew it went missing. They never notified. They didn't even have a breach notification plan. Map-Free Life Insurance Company of Puerto Rico, $2.2 million, 2,209 records were breached because they put them on an unencrypted USB storage device that was stolen. So before I go any further, and since we're talking about, to a degree, portable devices today, when we talk about texting and things like that, we use laptops, we use smartphones, well, for texting anyway, but bottom line, never, ever put any protected health information on a portable device unless that device is encrypted. Never. The number 2 way health records are breached in this country is loss or theft of non-encrypted portable devices that have health information on them. The number 1 way is hacking. As I stated before, HIPAA compliance is primarily based on risk. We know hacking is number 1, loss or theft of portable devices, that's number 2. We need to do something to mitigate risks in those areas for our organization. Now, the reason this group got hammered so bad, they had no risk management plan at all. They said they did, but when the government called their bluff, they had no policies, or really shoddy and really old. They hadn't done risk assessments, or they hadn't done one in years. So, serious situation if you are negligent. Children's Medical of Dallas, 3.2 million, 6,262 individuals affected. Same thing. Portable devices stolen that had health information on them and weren't encrypted. Same basic principle here. They had no risk management plan. Wasn't there. They hadn't done risk assessments in forever. They'd been told to even. Total neglect. Memorial Healthcare Systems got the biggest, and they had the biggest breach, 5.5 million, 115,000 records, because 2 unauthorized employees used credentials of some authorized employees. Bottom line is this. This group has thousands of staff members. They were not removing folks from the cloud-based electronic health record system when they would leave. So you had hundreds of users who didn't even work there anymore that could access medical records. Again, complete breakdown of common sense IT. Any IT person knows you need to audit your access list from time to time, and that's required under HIPAA, or it's addressable. I mean, it wouldn't, if you've got 5 total staff members, that's a different animal, but when you've got 5,000, being an addressable aspect of HIPAA, yeah, we need to implement this. We need to audit at least quarterly. We need to make sure as part of our termination procedures we remove these people. They weren't doing that. It ended up in a big, big breach and a big, big fine. All right, moving on to the subject at hand, emailing and texting. So I'm going to start, I guess we'll start more from the email perspective. There's been some changes here with email, more specifically in patient rights. With texting, there's been some changes too, more prohibitions on what we can do with texting in terms of non-encrypted texting. So let's start asking some questions straight from HHS. Does HIPAA permit us to use email to discuss health issues and treatment with patients? Or honestly, in general? Absolutely. One thing I want to point out about HIPAA as well, HIPAA is not intended to cripple our ability to communicate. That was never the intent. The intent is to put in reasonable safeguards to lower risk. That's the whole concept. So we can do this as long as we apply reasonable safeguards. What does that mean? What does reasonable mean? And here shortly we're going to go through a kind of a quasi-risk assessment relating to transmitting protected health information. Certain precautions would need to be taken, like making sure that you enter the email address in for accuracy before you deliver something, certainly, or maybe even sending an email alert to the patient for confirmation prior to sending a message. Now, while HIPAA does not prohibit the use of unencrypted email for treatment-related communications, or in general for that matter, other safeguards should be reasonably applied to protect the privacy, such as limiting the amount, which would mean abiding by the minimum necessary principle. If the orthopedic only wants you to send the x-ray of the ulnar bone, only send the x-ray of the ulnar bone. You don't need to send the entire medical record. Or the type of information. The type of information is absolutely critical. Not all health information is created equal. For example, a medical record number, all by itself, all on its own merits, is protected health information. Well, it's very nominal, though. If you transmitted without encryption through an email just the medical record number, and it were breached or intercepted, what real harm is going to happen? Whoever intercepted it would have to hack your electronic health record system to know who on earth that number is married to. Now compare that with an HIV record, a substance abuse record, a mental health record, a name, address, social security number, and credit card number. You know, those can do real damage and are extremely sensitive, and as such should never be transmitted without encryption unless you were sending it directly to the patient with consent. So an individual also has a right under HIPAA to request and have a covered entity or healthcare provider communicate with him or her by alternative means at alternative locations if reasonable. So a provider, for example, should accommodate an individual's request to receive appointment reminders via email rather than on a postcard if email is a reasonable alternative means for the provider to communicate. However, if the use of unencrypted email is unacceptable to a patient, you need to accommodate other methods like U.S. mail, telephone, patient portal. Here's a question I get all the time. What if the patient emails the provider or texts the doctor's office? They're proactively asking about themselves. Technically, you could probably get away with implied consent, but you need to let them know this is not a secured platform. Are you sure you want to communicate this way? Ultimately, patient has full power on their health information. They own the health record, we don't. So if they're okay with it, and they say, yeah, I'm cool with this, that's fine, I know there's some risk, it could be intercepted, I'm good. You can communicate with them that way, but you need to let them know. And I would have them sign off on some kind of request for confidential communications form, which I'll show you an example of later. Now, while we are communicating non-secured through unencrypted means based on a patient's request to send their information to a third party or to them directly, and they acknowledge the risks, and a breach happens or interception happens, are we responsible? The answer is no. While we are responsible for adopting reasonable safeguards and implementing the requests, like making sure you put the email address in correctly, because if you type the wrong email address in, then yeah, that would be a breach. But we are not responsible for disclosure of PHI while in transmission to the individual based on their access request to receive their information in an unencrypted or an unsecured manner. But assuming they were warned of and accepted the risks. This includes breach notification, liability, there's nothing going on with that. Plus, and I think this is clearly understood, once the patient receives their own information, that's their problem. If they lose it, that's their problem. Now, we are responsible for breach notification for unsecured transmissions and may be held liable for impermissible disclosures of PHI that occur in all other contexts except when fulfilling an individual's right of access. Under HIPAA, now this is important, individuals have a right to their information. They have a right to receive their information or direct their information to a third party in an unsecured manner. They have a right to it, but they need to accept the risks. They need to accept the risks. So very important to understand that point. Now, removing let's move away from patients and just talk about general communicating between providers and business associates, clinics and hospitals, you name it. Can we use email or other electronic methods to exchange information? The answer is absolutely yes. And it's the same basic concepts, reasonable and appropriate due diligence. So what I want to do is I'm going to pull out the specific standards and the specific implementation specifications relating to transmitting protected health information straight from the law, specifically straight from the law, and apply this and kind of show you how you understand how these risk assessments work and how we apply risk mitigation. And again, in the parlance of this webinar, we're doing a very narrow scope, just talking about transmissions of protected health information, specifically through email. So what we need to do, anytime we talk about risk mitigation, we always have to start with the very first standard of the entire HIPAA security rule. That's known as the security management process. And by the way, there are 18 standards and 44 specific implementation specifications of those standards. And later on, I'll show you where you can find all these things and also how you can do your own internal security risk assessment and as well as a full scope assessment later on. But so the first standard, security management process, implement policies and procedures to prevent, detect, contain, and correct security violations. The very first of the 44 implementation specifications is risk analysis. This is the most critical of them all. We must conduct an accurate and thorough assessment, and in a real full scope assessment, we would be applying risks to all 44 implementation specifications, not just the couple we're going to be doing today. But anyway, conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity or the business associate. So bottom line, find the risks. Find the risks in what we're doing when we transmit information. Then mitigate those risks through risk management. And mitigate the risks that we find to reasonable and appropriate levels. Very, very important. Reasonable and appropriate. Very important to understand that concept. This is a principles-based regulation. There is no silver bullet. There's no perfection. We are intended to put in reasonable and appropriate safeguards. That makes it a very gray law. You cannot think analytically here. If you think analytically, it will drive you bananas. The problem is so many IT people, IT backgrounds, tend to lean towards analytical thinkers. A doesn't always equal B. It equals what risk dictates it equals. So let's keep that in mind as we move forward. I know it can be a bit confusing, but let's just remember, reasonable and appropriate due diligence. Common sense carries the day so much here. So let's move down to the last standard, the 18th standard, which is transmission security, and look at what the law actually states and what we're doing to comply. So it states, implement technical security measures to guard against unauthorized access to electronic protected health information that's being transmitted over an electronic communications network. So obviously that's the most applicable to what we're talking about today about transmitting health information. Now the very first, and there's only two implementation specifications under this 18th standard. One is integrity controls. That's addressable. And note, it is addressable. It isn't required. There's a lot of implementation specifications that are only addressable. Because again, this isn't a one-size-fits-all. However, when something's only addressable, you still need to address how you are satisfying this. If this doesn't apply, this does not apply to us because of yada, yada, yada. However, if it ever does apply, we will do this, this, and this. You still have to address what you're doing to satisfy this. If it's not directly doing this, then what other things are you doing to satisfy this? So Implement security measures that ensure protected health information is not improperly modified without detection until disposed of. So what are we doing to protect things that we transmit, this information we transmit? Now let's dig deeper. And note that these questions that I'm asking, I didn't make these questions up. These questions come from the security risk assessment tool provided by the federal government at Health IT. They also come from NIST, the National Institute of Standards and Technologies, specific to this implementation specification. So are there adequate assurances that information's not getting altered when it's being transmitted? What type of PHI are we transmitting? Now that's critical. What are you transmitting? Like I said before, if you're a dental office, for example, and all you ever send are x-rays of teeth with a name, say to the orthodontist, that is protected health information, but it's just a tooth. It's a tooth. I mean, yes, it's PHI, but it's a tooth. Versus, say, an STD. Two entirely different animals. One far more sensitive than the other. So common sense dictates we're never going to be transmitting name, addresses, and social security numbers, HIV records, substance abuse records, things of that nature ever without encryption. However, if all we ever send is a medical record number, maybe a x-ray of a tooth, then, that's fine. The type of information is very nominal. How often do we do this? That's important too. How often are you transmitting? If you only send 3 a month, it's a very low risk. It's like the quarterback who runs the wishbone offense, old school, throws the ball 3 times, has a lower risk of interception than another quarterback who throws it 70 times a game. It's common sense. So where is it being transmitted to as well? Now let's look at the next implementation specification, encryption. That's also addressable. Now, it states implement a mechanism to encrypt protected health information wherever deemed appropriate. Is it necessary? So hypothetically, and this is consistent without the HIPAA security rules. Sometimes, if you satisfy one implementation specification, you kill 2 birds with 1 stone. So hypothetically, if we encrypt everything we transmit, period, via email that maintains any protected health information, then therefore you have satisfied integrity as well. Integrity of the data is satisfied based upon the encryption. So that's common with many other aspects of the security rule as well. So is it needed? Maybe, maybe not. Is it cost effective and feasible? Now, cost effectiveness is kind of hard to say it's not, because third-party encryption is extremely cheap these days. Now, feasibility, though, there are certain situations where I know in some states the Department of Health will not accept encrypted messages. Some insurance plans will not accept encrypted messages, so you can't encrypt to certain groups like that. What mechanisms are available? And if it is determined, let's say we're a substance abuse clinic and we have to deal with the SAMHSA laws as well, and which is kind of like HIPAA on steroids. That type of information is very, very secured, one's substance abuse addiction records. But anyway, and it's deemed that we have to encrypt, period. Well, have you trained your people on how to do it? That's a big deal too. Do they understand how to use the technology? So is it needed? Maybe, maybe not. We need to look at this. It's based on risk, depending on what you're sending, how often you send it, how much information is flying around everywhere. And don't forget, when you send something in your email, it remains in your sent items. So where you keep your email and when you access your email needs to be secured as well. For example, no smartphones should ever be allowed to access work email that's transmitting health information unless the smartphone itself is encrypted with a PIN or biometrics. Is it cost effective and feasible? I mean, cost effectiveness it's just not a big deal anymore, I don't think. And there's a million third-party email encryption software out there. You just have to pick one. Another thing, too, there are ways to encrypt what you're sending that cost you nothing. I call it poor man's encryption. This isn't a long-term solution because it's a little cumbersome, but for example, if you need to send some very sensitive information and you need to email it and you don't have encryption, you can type it up in a Word document and you can encrypt the Word document. Any Microsoft Office product does this. You go to File, Protect Document, Encrypt with Password, and always use at least an 8-character complex password. Or if you needed to send like 15 documents and you need to encrypt it all, zip it up using WinZip. Zip them up into the one file, encrypt the one WinZip file when you send it. Very simple. It doesn't cost anything. Now, I mentioned earlier about a confidential communications request form. If a patient wants their email sent, wants their protected health information sent to them or sent to a third party, non-encrypted, or they want to use text to communicate with the provider, or Skype or FaceTime, which some counselors and therapists use, which is not, quote, HIPAA compliant. The patient's okay with it, it's fine to do, but they need to sign off on it. Some form like this, and you can reword this any way you want to fit your organization, but you can communicate with patients through non-encrypted means like email, texting, Skype, FaceTime, as long as they're okay with the risks. As long as they're okay with the risks. They need to sign off and accept those risks and cover yourself. I mean, worst case scenario, if you can't get them to sign, at least get it in writing through an email exchange or verbal, and then document when it was done, what time it was done, and who took the verbal authorization. We can't talk about email without talking about the dangers of email, because email and what comes through email is one of our biggest risks of breach. So not only do we need good technology, good firewalls, good antivirus, anti-spam, email filtering, good technology. Do not go cheap on your technology. If you're using cheap consumer-grade equipment and you get a breach, you will be held accountable. I cannot stress this enough. This is not the area to go cheap on. This is not the area to trust the doctor's 13-year-old nephew to handle your technology or the business owner's drunk brother. You need professionals to put in business-grade firewalls, business-grade antivirus, anti-malware, anti-spam, and that's not going to stop everything, but it definitely shows reasonable and appropriate due diligence. Now, that's important, but also education. For example, educating your staff on spoofed emails. If you ever receive an email from your boss or from a coworker saying, hey, I'm locked out of the system, can you provide me a username and password so I can get in? Never reply. That's what's known as a social engineering style hack. Your antivirus typically won't catch this because it's not really even a virus. It's a spoof. And they need to be educated because data is worth more than oil. And there could be someone sitting in Russia right now looking at your website, figuring out your org chart, figuring out who's who. And you spoof Dr. Jane Doe's email, and you send it to some subordinates. And all you're asking for is, hey, can you provide me a username and password? You're not asking for them to wire you $10,000 because you're trapped in Africa. No, that's the old school. This stuff's very clever, but education is critical. Now, what I'm speaking of are called phishing emails. They come in all shapes and sizes. It could be a spoofed email. It could also be an email that appears to come from Facebook, PayPal, Bank of America, Apple, Microsoft, popular companies. They're trying to trick you or entice you into clicking on a link that will download a virus. Here's an example of one. This one's from, quote, Facebook, not really from them, but they say you have copyrights problems on your Facebook page. You need to fill out this application, which that's what they want you to click on, or you'll be permanently blocked. They're threatening you in this particular one. So if you click on that link, more than likely you're going to download malicious code, such as ransomware, which we'll talk about ransomware in a second. Cyber attacks. Number one way health records are breached in this country. Number one way sensitive data is breached, period. And that's across the board. So we know that. Let's mitigate those risks. Healthcare is a big target because historically it's been weak because the regulations have not really been enforced. Now, you can go to the OCR's portal. It's all public domain. Any group that's had a breach of over 500 records has to be put on this portal. And what I did is sort by the biggest breaches ever. And when you look at how they happened, hacking, number one, loss or theft of non-encrypted portable devices, number two. And Anthem is still the champ, by the way, with 78 million. Pretty bad one. All right, ransomware. This comes through email. These types of viruses usually come through email, through a phishing email that someone clicked on. One thing I recommend doing is you can hire your IT group or a third party to spam your organization intentionally. They're harmless. You let them through and see who clicks on the fake email. See who falls for the trick. It's a good training tool. But anyway, ransomware, the law has changed on this. The federal government changed the law. What is ransomware? This is by far the most dangerous virus relating to breach because it's very intelligent. It attacks databases and it attacks file shares. If you have protected health information in your databases, which most certainly you would if it's an EHR system, or your file shares, maybe you're saving scans of stuff, this will attack that, it will encrypt them, and you cannot get access until you pay some creep X amount of Bitcoins before they give you the decrypt code to get back into your stuff. The problem is the federal government made this official. Ransomware attacks, if they attach to a non-encrypted database that has health information in it, or a non-encrypted file share that has health information in it, it's a breach. And just FYI, a file share would be like your H drive, K drive, M drive, Z drive, whatever you call it in your server environment. So if they get attacked, they get encrypted, it's a breach. That's a nightmare. It's a complete nightmare. And you know, in the old days, I would argue with the government and say, look, yeah, the virus got on the database, but it was just the virus. A human being didn't log in to the application to be able to see Billy Bob's health information. It was just the virus. Government does not care anymore. They say, nope, that is a breach, and that's of last year because they have taken control. Even if it's sitting on your server, they have taken control. It's a breach. Unless your database is encrypted at rest already, and your file shares, if they have health information in them, are also encrypted at rest already. Now, that's not required under HIPAA, but if you can do it, you definitely want to do that because if that's the case, the safe harbor applies, and it's not a breach. Not a breach if they're encrypted. So the three ways we want to protect ourselves from this catastrophic event: number one, good technology. Good antivirus, anti-spam, anti-malware. Hopefully we'll catch this. Number two, education. Education on not clicking on these things in the first place. Number three, encryption of databases and file shares that maintain protected health information. Personal devices. So this BYOD, bring your own device, as it's also known as, this is becoming not really the exception anymore, but kind of the norm, especially in small businesses, Now, there's nothing inherently against this in HIPAA, but remember, it's about risk, right? We need to talk about risks of personal device use. Now, it's steadily growing. The technology is ahead of the compliance, which is kind of always the case, and it is considered by most IT managers as one of your highest risks for technological breaches of sensitive data because you can't control if their system's up to date with its antivirus, they're using good antivirus, they're updating their patching, you know, that kind of thing. It's hard to know. The conundrum, it's effective, it's very cheap, they already own it, it's easy to use, but there are risks and manageability concerns for sure. The positives: use of your personal device provides flexibility, can streamline communication, And you could make the argument one's more productive. Maybe they're a Mac guy and they're better on their Mac, rather than using the business phone. And the money you save is very substantial because you're not purchasing equipment. You're not purchasing data plans as a business owner or practice owner, whatever you are. Allows for easier teleworking, preferred by most staff members, and employees can use apps to a point anyway that they prefer for productivity. Now the negatives, and if you are a personal device use company, you need to have a policy in place, a personal devices policy, which answers things to the effect of who is responsible for support or repair. How do you know these devices are secured? Are you going to require them to let IT look at these personal laptops and make sure they got good antivirus, they got the up-to-date patching and all of that on there? What about compatibility problems? Most importantly, how do you know they're not downloading protected health information? So the best case scenario in a perfect world would be you technically engineer out any ability for someone to download protected health information. For example, maybe you've got a cloud-based electronic health record system, but you can only go in and view and work within the system. It's impossible to download. There are some that are that way. Now, in that case, you have a very low risk of being compromised. Of course, there's always a risk of being compromised if someone on their personal machine were to get spyware and some hacker can capture their keystrokes and get their username and password to log in, but it's a much less likely for getting other types of compromises because at least the person can't download to their device, which probably wouldn't be encrypted, that if it were lost or stolen would be a breach. Now, encryption, very important. I'll just jump to the point here, and here's my recommendations relating to personal device use. So let's start with the smartphones. If you're using a personal smartphone to get your business email, which is typically what you use them for, or perhaps even texting if you have a secure text app, the smartphone itself has to be encrypted with a PIN or biometrics. Both Androids and iPhones can do this. iPhone is simple. You turn on the PIN, you turn on biometrics, and the thing's encrypted. A couple extra steps with an Android, but it's not hard. That has to happen, period. You're crazy. Honestly, you're insane not to secure your phone. Forget HIPAA for a minute. If you don't secure that smartphone, someone gets it, they're going to know so much about you, it's unbelievable. They're going to know where you live probably because of the GPS waypoints, getting your email, your text messages, your notes, possibly into your bank accounts because these things cache passwords like crazy. So definitely there. Now, if it's a Mac, turn on encryption. Macs come built in with, I believe it's called File Vault. You can turn that on. Make it whole disk encrypted. That way if it's lost or stolen, the thief's just useless to the thief. If it's a Windows laptop, this gets a bit more tricky. If it's in my business, you're not going to use a Windows home-based operating system. Not going to happen. That's a consumer-grade operating system, does not have nearly the robust security features as the professional level. You're going to have to use Windows 8.1 Pro or newer because it comes with a better firewall. It comes with BitLocker, which gives you the ability to encrypt the machine. Also, I'm going to require that you use business-level antivirus, security suite, not some cheap free version of a very basic antivirus. No, business level costs about $40 a year. A professional level operating system costs about $100 more than a home-based. So maybe you can reimburse them, but I wouldn't. It's hard to justify in a business environment that you're using home-based, consumer-based equipment and breach occurs. I've seen this play out. That's why I'm adamant about this. The government will hold us accountable, and we could be held accountable in courts of negligence if we're using cheap, consumer-grade equipment to access, transmit, or store protected health information. So that would be my recommendations. Ideally, don't allow anything to be written. But that's not always possible. We don't live in an ideal world. Sometimes you need to download information. Sometimes you need to do that for a litany of reasons. Sometimes you need to download it to go work in, or like a occupational therapist, maybe working in a basement. You don't have any internet access, but you need your information downloaded. That's fine, but encrypt the device. And at the very least, encrypt what you downloaded, which we'll talk about a little bit more later. We want to make sure security updates are done, good passwords of at least 8-character complex, or biometrics if it's, or a good PIN on a smartphone. And of course, encryption, because a lost or stolen encrypted device is not a reportable breach under HIPAA, even if it has health information on it. Education, very important. Even if they're using their own devices, the better educated our staff members are on common cybersecurity threats, the safer our business is. Force complexity to at least 8 characters complex in the passwords. And make sure you do those risk assessments on an annual basis, or whenever any major technical, procedural, or legislative changes occur that might affect the organization. And as I stated, your number one compliance worry with personal devices, or I should say portable devices in general, is theft. This guy will steal it and put it in his little bag, so encrypt the thing. That's the most important point. Now let's move into texting. There's been a pretty significant change here relating to texting. And believe it or not, I am actually a proponent of texting because there's a lot of positives to it. Now, can you use texting in healthcare? So first, let me start with this. If you're only texting the patient, you can text patients with consent. You can text them even highly sensitive information with consent if they accept the risks and that's how they want to communicate. But you cannot do this with each other in your organization, not without encryption. Healthit.gov states that we need to make sure that we are securing what we're transmitting. There's been new guidance that has come out that, yes, you can text within your organization if it's encrypted, which is really easy to do. Now, we all know what regular old texting is. Everyone's doing it. It is being abused in healthcare. When it's unfortunate because there's so many simple solutions to do this the right way and not worry about it. So the positives of texting: it's fast, it's easy, loud background noise problems are mitigated, bad signal issues, are mitigated, and anybody can get a text message unless you have a bag phone from 1985 in your DeLorean, for example. So anybody can get a text message. Now, the negatives: sits on your device, doesn't get deleted in a traditional text unless you delete it, very easily accessed. It's not monitored by IT. It's impossible, really. Now, interception is simple. People can intercept text messages very easy. There's apps for that. You can use a packet sniffer. You can be sitting in a parking lot or in an airport and just you can hack these things easy. So HIPAA now, we are not allowed to use texting at all unless it's encrypted, except when communicating directly with a patient with consent. You can send appointment reminders. You can send prescription refills. You don't have to encrypt any of that as long as they opt in. You can send more information to patients if they're cool with the risk. Not with each other, though. So if you, and providers, one more thing, providers are not allowed to text patient orders, even if encrypted. Even if encrypted. No texting of patient orders. In my opinion, that's a little bit overkill. I don't see what the difference is in sending it secured versus the phone, but the government's stance is that if you're texting patient orders, the patient order will not get into the electronic health record where it is supposed to be. So, other than patient orders, if you guys want to use texting in your organization, The very simple solution is just download a third-party app. There's a million of them out there, third-party text encryption apps. Some of them are free. Some of them cost a little bit. They offer more robust functions. There's a ton of them out there, but you're going to have to decide on one because you can't do this without it. You can't. So pick one out. Test it out. See if you like it, because that's what's going to have to be done. Oops, I went too far. So again, we need to talk about theft risks and proper disposal risks of these phones, interception risks, and lack of availability other than the mobile device user. And with a decent text app, you can set up groups, the nursing group, the billing group, the scheduling group if you wanted to, and it's just as easy to use as a regular text. That's why that is a reasonable and appropriate solution. We need to certainly have policies on this, policies stating the prohibition on texting any PHI unless it's directly to the patient with consent, unless we're using ABC text encryption app, whatever you prefer. You guys could use. Check them out. There's a lot of them out there. There's a lot of good technology that's out there you're probably not aware of. I get asked by these groups all the time to audit them and vet them for compliance. There's a lot of really good technology out there that makes life easier and more secured. So smartphone always, and so one more thing too, encryption in transmission, that's great. Like you get a third-party text app, but if you don't encrypt your phone, it's useless. If you don't encrypt the phone, you leave your phone at the baseball game, I pick up your phone, I can go on your sent items, see everything you sent, whether it was transmitted encrypted or not, because the phone wasn't encrypted itself. The phone wasn't protected, so make sure you protect that phone. Another thing about emailing, here's another question I get a lot. Do you need to encrypt emails with health information inside your own domain? The answer is typically no. Typically. Now, there are exceptions to that rule. I'm not talking about like yahoo.com. I'm talking about your internal domain like abcinc.com. But no, you typically don't. But when you transmit outside of your domain, certainly if it's a highly sensitive amount of PHI, then yeah, you do want to encrypt. But double check that with your IT, because some domains that's a little different. USB sticks. So there are some groups, medical practices and clinics that patients, have a civil right to their health record, and some groups will put it on media for them, like a USB drive. That's fine, but never the patients. Don't take their USB drive and ever plug it into one of your systems. If you're going to provide that kind of media, you really should go to Staples or Office Depot and buy in bulk a bunch of thumb drives that don't have viruses on them, and then put the patient's information on there, their health record, and give it to them like that. And you do not need to encrypt a USB drive, for example, if you're handing it directly to the owner, which is the patient. However, if you were burning a bunch of x-rays to a USB drive that you were going to mail to a radiologist to take a look at them, you would want to encrypt the drive. Let's talk about suing real quick. We won't spend a lot of time here, but this is a very big deal these days. This has changed the landscape. When I talk about omnibus, that's of course the final HIPAA omnibus rule of 2013. And how does that relate to suing? Patient remedy. And don't get me wrong, if your health information's been breached and it cost you some kind of anguish, slander, financial loss, yeah, you should have a remedy, absolutely. But the problem is, we live in America. People will sue for anything, and we're seeing that here. They'll at least file the complaint and try, even though the case is weak. Many times a hospital will just say, just give them $10,000 to go away because we don't want to have to lawyer up and waste all this time. So anyway, that's part of the problem here. But to be clear, though, nobody can sue under HIPAA. That is a federal law. There's a bit of misunderstanding here. No one can sue under HIPAA. Now, as nasty as this law is, and we saw some of the fines, and as nasty as the criminal aspects can be, and I've worked cases where individuals have been turned over to the Department of Justice for violations of one's HIPAA rights, pretty egregious stuff when, like, ex-girlfriend goes into the boyfriend's new girlfriend's health record and discloses some highly malicious intent stuff. That's a 10-year, up to 10 years in federal prison for that type of gross violation of one's civil rights. Now, and then, of course, that's a civil aspect or criminal aspect. And there's serious consequences, as nasty as it is. But there's no individual remedy under this, not at all. So what happened? The federal government wanted to fix this, but figured that it's better that that be handled on the state level, which I think they're right in that regard, than on the federal level. So what they did is told all 50 attorneys general, implement laws in your state for individual remedy. However, when someone's going to sue for a wrongful disclosure of their protected health information, come to us, the federal government, first with your complaint, because we need to know these complaints, because our goal is to, as a collective whole, make security of protected health information better in this country. So we're seeing a huge increase in complaints, because that's the first step you would take if you're going to sue. Now, that's not the only reason people file complaints, but that is certainly a reason. Now, it took a while for trial attorneys to pick up on this, because it didn't happen overnight. Anytime the government, federal government, does something, especially in a tangential manner, it's slow. It's like, I don't know, turning an aircraft carrier around in the Mississippi River. It's not going to happen immediately. It's going to take a while, back and forth, back and forth. So these days, though, it's pretty common. And I have personally worked in, I believe, about 27 states at this point, both directly and indirectly, where precedence has been set. I assume it's been set in all 50 states. So definitely something to be concerned with. Now, went too far. Bottom line is, someone's really going to have to prove that something of consequence happened. A wrongful disclosure of your tooth x-ray, although is a breach on the dentist, you're going to be hard-pressed to prove that that really harmed you in some way. Now, the dentist office might get fined by the federal government for not being compliant, but you're going to have a hard time winning anything for that. It has to be pretty substantial. So moving on from that, talking about risk assessments, remember, when we talk about these things, when we look at the entire law, it's based upon reasonable and appropriate due diligence for the most part. Now, there are parts of the HIPAA privacy rule that are just pure policy and procedure and kind of instructional, but the security rule is all based upon reasonable and appropriate due diligence. It's a pretty robust 18 standards, 44 implementation specifications, but for a really small group, a lot of these addressable aspects just aren't going to apply a lot. For a much larger group, they will. For a very large group, probably going to have to deal with every one of them because of the risks. A couple of resources. Healthit.gov is a fantastic resource. Not just HIPAA, but there's a lot of HIPAA things involved here. There's also a free risk assessment tool. They just updated this, by the way, to version 3.0. Finally, I've used this tool 15, 20 times, I don't know, throughout the years. I don't like it. It's too quirky. It's too quirky. But I do use a lot of the questions they ask in this, just setting up my own risk assessment. There's no perfect way to do a risk assessment as long as you go through all the standards, you go through all the implementation specifications of the law, and you ask questions for each one, and here's what you're currently doing. Is there a risk involved? If yes, here's what we're going to do to mitigate that problem. HHS.gov is the governing body. So don't fall for snake oil. Be careful with what you read online about HIPAA, because there's a lot of misinformation out there. Not all of it's nefarious, trying to sell you something. It's also partly the federal government to blame, because the law is just not explained well. It's not easy to find this stuff. It's really not. I do this for a living, and you just stay on top of it and comb this stuff literally daily to see what's going on. So HHS has a very good frequently asked questions section. Another thing too, we're talking about, through the parlance of this webinar, HIPAA. Okay, that's a federal law, and about what it says about transmitting protected health information. Now, you may be in a state, you may deal with some state or some municipality laws. Like, I do a lot of work in the Los Angeles County Department of Mental Health out in California, and they have really strict laws on what they require that are more than the federal level. HIPAA is the base. The states can never be less, but they can add additional security methods. Now, in general, it's pretty congruent with HIPAA, but you do get into some weird areas, like, is a 14-year-old pregnant girl who's still on her dad's insurance, is she now an emancipated minor based upon the security of her health record at that point? Weird stuff like that falls under the states. But HHS and the frequently asked questions is really good about saying refer to your state law on that one. Now, there is if you are audited by the federal government for HIPAA, they are going to do a full scope audit, especially for a covered entity. If you're a business associate, it's going to be pretty much purely a security audit, HIPAA security rule audit, because a business associate really wouldn't be dealing with much of the privacy rule. That has more to do with patient access, that sort of thing. Now, the government goes by this protocol. You can copy that link, and if that link doesn't work because they changed things on me, just go to HHS and type in the audit protocol, HIPAA audit protocol 2018, and it's been updated. This is an old slide, but that's what the government's going to go by, and that's what you can go by to do a self-audit. And this goes through every single standard, every single implementation specification of the privacy rule, security rule, asks questions for each one, and you can assess what you're doing. Is there a risk? Are we complying? If not, there's a risk, then we need to mitigate that by doing X, Y, and Z. If you want a truncated list of all of the standards and all of the implementation specifications of the security and privacy rule, now the previous audit protocol had that list too, but this is more truncated in a simplistic PDF. It's not geared to be a self-assessment. You can copy this link. Again, if the link doesn't work, just go to hhs.gov and type in HIPAA Administrative Simplification Regulation Text. Not exactly a fun read, but that is where all of the standards are. So bottom line here, and this is a quote straight from HHS, we are not expected to be perfect here. We are expected, though, to follow the security and privacy rule standards, implement proper policies, procedures, and technologies, and reasonably show that we are indeed making an effort to protect against common threats and vulnerabilities. Very, very important to understand that. This is not a perfect situation. Breaches do happen. They're going to happen. That's okay as long as we've lowered our risk, lowered our risk the best that we can. And be proactive. That is the most important thing. You don't have to be perfect. And I can't stress again, get in front of this. Don't get behind it. That old adage, what was it? An ounce of prevention is worth a pound of cure. Definitely applies with this type of regulation when we're dealing with a principles-based regulation like HIPAA. So without further ado, it looks like it's just about 2:20 Eastern. I will open this thing up for Q&A if you guys have any for me.